Well, that clock is ticking. We are running out of time before the Affordable Care Act deadline. Today on 2 Wants to Know, we've got experts who can advise you on the ACA, on Medicaid, and on Medicare as well. That's right, we're going to hit all the bases with these experts behind me. Catherine CVA is with AARP North Carolina. Steve Edmonds is with Alliance Insurance Services, and Laura Packard is from Healthcare Voices. They are here to help you navigate through the tricky process of health insurance. What we want to do is take your questions. So you can text us those questions, 336-379-5775. All the questions are anonymous and you get your question answered in real time. Okay, the first thing that I want to talk about, since the ACA deadline is January 15th, a lot of people have been kind of getting mixed up. What's the difference between ACA and Medicaid?
So the ACA is the Affordable Care Act, and most of the time you're signing up with insurance on it, and you're using an income basis. So you're putting an income in, and sometimes people will get subsidies for that. Medicaid is also income related, but most of the time people are getting, free coverage there, or at least almost free. And so there's similarities between them, but they are definitely different because you have to apply for the Medicaid coverage usually through the state that you live in.
All right, and Laura, Medicaid just recently was expanded in our area, and a lot of people don't know whether or not they actually qualify.
Yes, so you should start at healthcare.gov, and it will tell you what you qualify for. Either way, you can get a great insurance plan through the Affordable Care Act, or if you qualify, you can get Medicaid.
Okay, either way, it's kind of like one-stop shopping because you're going to go online and you're going to figure that out pretty quickly. All right, so that's ACA and that is Medicaid. We're just kind of like dipping our toe in the pool here of all the things we're going to talk about. Catherine, let's talk about Medicare, and there is something that is different this year.
Absolutely. So this year, as part of the Inflation Reduction Act of 2022, we've seen a couple of changes. And last year we saw insulin prices being fixed at $35 a month, and we saw vaccines being available free. This year, there's a change in how the pharmaceutical payment is for your drugs, and there is a new catastrophic cap of $8,000. You won't pay the $8,000 because you're only paying a percentage of that. So you should expect that once you get to that percentage, which they're estimating to be around $3,000 to $3,500 a year, then you don't have to pay anymore for your prescription drugs. And those are your non-generics. So the drugs that are so pricey, there's going to be better controls on them this year, which is good news for everyone who has an expensive drug in their life.
Yeah, so basically you're going to hit that deductible maybe earlier than you did other previous years, and then you're not going to have to pay.
That's exactly right.
Okay, this is good news. For sure. All right, Steve, is there something you wanted to add on? What's something new for Medicare this year?
So it's not really new, but we do have Medicare open enrollment period. A lot of times people don't know about open enrollment periods, but from January 1st until March 31st is an open enrollment window for those people that have either prescription drug plans that are standalone plans or people that are covered under Medicare Advantage plans. And during this period of time, it's a 3-month period. And if you've got a plan that you're not crazy about, maybe you thought you were going to be crazy about it, but now you've had second thoughts and you're not crazy about it, this gives you a one-time opportunity to switch those plans out between January 1st and March 31st. The only reminder there is once you switch, you're locked in then. So you get one time to switch, and then you're locked in until October the 15th when annual enrollment rolls around again. So it's a one-time opportunity for basically a do-over, I guess, would be a good explanation there.
Okay, and this is because folks had open enrollment for Medicare, right, and it ended like early December, and they picked a plan, and then they've been living with it for like this first month or so, and then they go, oh, things changed that I didn't think I wanted to be changed.
Exactly, yes, and so that gives you a one-time opportunity to jump off of that plan and maybe jump into a new plan.
Okay,
Yeah.
gotcha. All right. So we're taking questions on all those things, ACA, Medicaid, and Medicare as well. Hey, Laura, I want to get to the ACA plans. So January 15th is the deadline. Now, this is for people who don't have coverage, but also people who maybe picked coverage in December and don't like that one either?
Just like Steve said, if you picked an insurance plan that you're not so crazy about, you still have a chance to change it for this year if your insurance is through the Affordable Care Act, because January 15th is the deadline. If you make changes this month, it'll take effect February 1st. So you do still have time to change things if you need to. And also, if you miss the January 15th deadline, but you become eligible. So for example, you move or you have a life change, like you get married or divorced or have a baby, you will be eligible then to make changes to your health insurance. But for everybody else, you got to wait till open enrollment rolls around in November.
Okay, gotcha. And Catherine, if folks are, they have that Medicare plan that they signed up for and they're not sure if it's going to be the best fit, there are some AARP tools and resources that might help them out.
No question about it. If you go on the AARP website to aarp.org to Medicare, there's a lot of material there about what's covered, what isn't, and some help in how to make a decision about all of that.
Okay. All right. We're going to continue to talk to these experts about all things healthcare and insurance wise. We're taking your questions when we come back. So 336-379-5775, and we'll see you in a few minutes.